My name is Dr. Jill Ginsberg, and I've been a family physician for over 20 years. For the last 2 years, I've been the volunteer medical director at the North by Northeast Community Health Center, which is a free medical clinic for uninsured adults living here in the inner Northeast and North Portland neighborhoods. In that time, since we opened 2 years ago, we've seen over 1,500 patients, all uninsured, and many really desperate for a solution to their health problems. Many are between jobs. They've lost their jobs for a variety of reasons. Their position was outsourced, the company closed down or moved, or they got sick. Because in our country, here in America, if you get sick enough to lose your job, if you get sick enough not to be able to go to work, you will not only lose your job, but you'll lose your access to health care. I just want to read a couple of statements from patients that we've seen. When I was working as a meat cutter, I was able to have medical insurance for my daughter and myself. After being out of work for 2 months, my insurance ended and I was scared of not being able to get my medication. I really don't know what I would have done without this clinic because my problems are life-threatening. I don't have the money or health care benefits to be seen by doctors and nurses because of no health insurance. So I write this with thanks for those who have assisted me at North by Northeast. I have high blood pressure, and if it wasn't for this program, I could possibly be dead or suffering from a stroke or heart attack. Through this program, I am now registering a normal blood pressure reading. So our patients are unemployed, they've lost their health coverage, and one thing that I didn't understand that we've seen a lot of is that when folks lose their health coverage, not only do they lose their health care, but it's very difficult for them to get another job. Because if you've got a medical condition, even a easily controllable medical condition like high blood pressure, a lot of employers won't hire you until your blood pressure is under control. We saw someone not too long ago who had lost his job and his health insurance, ran out of blood pressure medicine, and even though he was on an inexpensive medication, he couldn't afford a doctor's visit to get a new prescription. And he went to get it, found a new job, went to start work, and took a pre-employment physical, and because his blood pressure was high, they wouldn't let him start work. So even though his family depended on him for a salary, and he lives in the richest country in the world that spends twice what any other country spends for health care, this gentleman was not able to work because he didn't have access to $4 prescription for blood pressure medication. So thank you all for what is happening today, and for some movement to improve things in our country.
Thank you so much.